My name is Jim. I'm Jim Ewing. I'm from Florida.
Florida, okay. Jim? Jim, you prefer Jim?
Jim.
Okay.
Yeah.
You are down here for dental?
Yeah, dental implants. I got 4 of them earlier in the week.
Okay, go ahead and tell me all about it, starting from the beginning of when you decided to actually come down to Costa Rica and your search of how you came to Costa Rica.
Okay. Originally, I had the work started when I was in Venezuela 2 years ago, and the situation there was such that I left and was looking for a place to get it done. I had references to a doctor up in Guatemala that a friend of mine had used, but was unable to get a good communication established with him. The websites I checked out led me to look down here in Costa Rica, and I contacted the 3 dentists at the time that were certified implantologists. They all got back to me one way or another, and from basically interviewing them and getting a feel for how interested they were in my case specifically, chose the one that I used for the implants.
Excellent. And even before that, had you considered doing these the implants where you were from in Florida?
Yeah, I checked in several places around the U.S., but the cost advantage here was such that it made more sense to come down here to get it done.
If you don't mind, can you give me a comparative to what you paid down here versus what you would have paid in the United States?
Compared to the best estimate I got in the U.S., it was probably about between 1/2 and 2/3, and compared to the worst estimate I got in the U.S., it was between 1/3 and 1/2 of that cost. So I figured with all the travel and lodging expenses as well as the treatment here, I probably saved between 25% and 50% of the cost in the States.
Excellent. Let's talk a little bit about where we're staying right now, where we are at in Las Cumbres.
See.
Tell me about the place.
Place is great. It's a very small inn. I don't know how many rooms they have exactly, maybe 10 or 12.
I think they can go all the way to 15.
15? Oh, the ones on the outside downstairs. I haven't seen those. Room's very nice, very clean, very comfortable. It's got a great shower, the biggest shower I've seen in a hotel. The food is excellent. The staff is outstanding. They allow me to be an idiot in Spanish and correct me when needed.
Let's talk about that for a moment. How was Spanish, how did that play into your treatment as well as the recovery?
For the most part, it didn't really impact it one way or another. Basically, everybody I've talked to here regarding my treatment has been at least moderately fluent in English. So the language isn't really a barrier unless you, like I do, want to go off on your own and wander up to Belo Horizonte or down into San Jose to just sightsee on your own. Excellent.
And some of the ladies here commented about the camaraderie of everybody at the place.
Yeah.
You feel the same?
Yeah, this has been a great group. The other night, the big meal here is at lunch, and so you get more of a lunch-size meal at dinner. And several of us were feeling still a little hungry, so we made this rash decision to pile into 2 cabs, and seven of us went over near the Multiplaza and got ice cream.
Oh.
Yeah, so it was a little adventure out, and card games, movies. It's been a good group this week. The biggest obstacle in anything like this is feeling very comfortable with who you're dealing with. The doctor I used, who was Arnaldo Anglada, he's an oral surgeon here, from the very beginning had specific questions about my case. He asked if I had any x-rays, to send them to him. We spent probably a half hour on the phone at the very beginning of my search, and he was just like asking me about it, telling me what I could expect after he'd gotten the x-ray, and basically gave me a very, very thorough consultation, even though we were separated by a couple thousand miles at the time.
Excellent. So you felt comfortable at the end of the day coming down? And,
yes.
Okay.
Yeah.
And how did you find Las-Cumbres?
I found LasCumbres by one of the other dentists' referral. Actually, both of the other dentists sent me information on LasCumbres.
Compared to the United States, what would you have paid dollars and cents versus what you paid down here?
Based on the estimates I got, it would have been somewhere from between about $6,000, maybe a little bit higher than $6,000 to a little bit higher than $8,000. And down here, just for the treatment, I paid a little less than $4,000.
Okay. And what exactly specifically was your treatment? What did you get done?
The treatment was 4 molar implants in my lower jaw, 2 on both sides, and the necessary recovery drugs and x-rays preparatory for the treatment. I have to come back in 3 to 6 months for the finishing work, which includes the crowns that will replace my lost teeth.
And that was included in the price?
That was not included in the price for this treatment, and it wasn't included in the price I compared it against.
Okay. And you wouldn't consider doing the follow-up treatment in the United States?
I would, but I still think I can get a free vacation out of the deal. And Costa Rica is just, you've been here 10 years. It's an amazing place with amazing people, and it's.
So let me ask you this: was this trip, was it vacation motivated? Was it price motivated? Was it the recovery spa motivated? What exactly was your driving factor?
The perceived quality of the treatment I would get, which my expectations were met fully, and the price.
Sure. Would you suggest this to somebody else, friends, family?
Oh yeah, definitely. In fact, I write a blog, and it's kind of a humorous blog, but the healthcare system here is rated just above the healthcare system in the U.S., but I think the overall cost is something like 50 lower on the list. So it's you basically get the same care here that you would get in any place else in the world, at least as good as the U.S.
And saying that, did you have any reservations about coming down to a foreign country, third world country at that, and putting your medical needs into the hands of doctors down here?
No, not at all. I've lived outside the U.S. for the past 2.5 years, basically, and have gone to doctors in Venezuela, in Grenada, and I found that doctors out of the U.S. are as well trained. The concept of the third world is really not there anymore. Anything you can get in the U.S., you can basically get any place else you want to get it.
Excellent. And you will be coming back, whether it be for medical, dental, or just straight vacation?
Oh yeah, definitely. In fact, this winter I had originally planned to come down here for 4 or 5 months and have this all taken care of, and then just been out in the countryside when I wasn't being in San Jose for the treatment. My plans had to change a little bit, but that may have been a mistake.
That's all right. Well, it's been nice speaking with you, Jim.
Okay, you too, Tommy.